All right. Well, good morning, everybody. On behalf of the Northwest Mental Health Technology Transfer Center, please welcome and be so excited for our guests, Dr. Jennifer Piel and Dr. Sarah Cusworth-Walker. Our webinar today topic is forensic mental health practice and training. I'm sorry, your role in advancing evidence-informed behavioral health policy making. This is the second webinar in our three-part series on forensic mental health. We're so grateful many of you could join us to learn more about this important topic. My name is Christina, and I'm one of the co-directors of the Northwest MHTTC. So this is our title. These are our very esteemed colleague presenters, so hope you're in the right place. We're excited you're here. The MHTTC network is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. Our purpose includes disseminating and implementing evidence-based practices for mental health issues into the workforce. Some of the goals of the network include supporting evidence-based practices, heightening the awareness, knowledge, and skills of the workforce, fostering regional and national alliances, and providing and connecting you to free training and technical assistance like today's event. Now, a little bit about our Northwest MHTTC. We are based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We provide training and TA in evidence-based practices to Region 10, which is Alaska, Idaho, Oregon, and Washington. Our area of focus is evidence-based practices for serious mental health issues, such as psychosis. However, we provide training on a variety of topics, including integrated care, suicide prevention, diversity and equity issues, school mental health, peer support, trauma-informed approaches, and others. And our target workforce includes really anyone whose work has the potential to improve behavioral health outcomes for individuals with or at risk of developing serious mental health issues. How do we fulfill our mission? Well, live events like this that we also record and post on our website. We do virtual learning communities. We have free self-paced online courses. We have newsletters every month and a resource library on our website, and we connect you to other training centers and events. So to find out more about our goals and our training opportunities, feel free to visit our website and sign up for our newsletter if you're not getting it already. Land acknowledgement. We are in a virtual world, we understand, but just we want to acknowledge that we have many cultures and lands across our region in Region 10, and we want to acknowledge that specifically based in Seattle, where we are located, we sit on the traditional land of the Duwamish and Coast Salish peoples, past and present, and we honor with gratitude the land itself and the people who have stewarded this land throughout the generations. Little bit about language. We're always intentional about using language that promotes recovery and culturally appropriate terminology. In some ways, I know this is a moving target, but we just encourage everyone to use language that demonstrates respect for people's dignity and worth. And that just helps everyone feel on a level playing field. So next, we want to review some logistics regarding communication in the session. So it's a pretty large audience. You're muted and not appearing on video. Obviously, the presentation is being recorded, and the recording and the slides will be made available on our website in a few weeks, which you'll be notified of by email. You'll also receive an email within a couple of weeks on how to access the certificate of attendance. There are no formal CEUs, but these do look pretty legit, if you will. And so generally people have been able to use them to apply for their various licenses in their various states. If you're having any technical issues, please use the chat and our MHTTC team will assist. And then if you have a content related question, we will be doing questions after the presenters go through their material. We'll be monitoring the Q&A box throughout the presentation to facilitate answering as many questions as we can. So please put them in the Q&A box. If you accidentally put them in the chat, I can't copy and paste it. I don't know why. So we'll probably ask you then to please retype it into the Q&A. But type those in at any time. I won't interrupt them during the presentation, but we will moderate and do those at the end. And we might provide a short written response, but hopefully field as many as we can as time allows. Lastly, your feedback is so crucial to our work. The presenters were in fact just asking about how do we hear how it went today. So we'd appreciate your response to a very short survey. It takes just a few minutes after the session. We will share that link via the chat box. We'll have an email reminder via Zoom. And we are required to conduct this survey, so it shows them that we've done some things. But we mostly really appreciate the feedback to help us evaluate how it went, plan future sessions, and it helps keep the free training coming. Obviously, SAMHSA sponsors this work, but does not reflect any official position on this content, but we need to do our little slide here. Now, the important part. Jennifer Piel, MD, JD, is a clinical and forensic psychiatrist. She is an associate professor in the Department of Psychiatry and Behavioral Sciences at the University of Washington and the director of the university's Center for Mental Health Policy and the Law. She received the 2017 American Medical Association Foundation Excellence in Medicine Leadership Award, in part for her advocacy for persons with mental illness who have criminal justice involvement. She is the legal digest editor for the Journal of the Academy of Psychiatry and the Law. She specializes in psycholegal assessment, research, and education. And if you missed her session last week, you can find that on our website pretty soon. It was also very informative. And Sarah Cosworth-Walker, PhD, is a research associate professor and director of a research to policy center in the Department of Psychiatry and Behavioral Sciences at the University of Washington. Her center, the Co-Lab for Community and Behavioral Health Policy, conducts and researches methods of bridging science and community voice to improve public health. She's the recipient of a 2014 MacArthur Foundation Champion for Change Award and a 2019 Robert Wood Foundation Health Equity Award for her work in juvenile justice system reform. So we're very impressed and excited and very grateful to have them with us. So you know who's going to be presenting, but I think at this point we will do a quick poll for who is here today. So I think our trusty colleague will run a poll, and just what is your work setting? And so as you vote, I can tell you what's happening, sort of like some sort of race or a sports event. It's all over the place. Educational and behavioral health clinic are neck and neck. So seeing, give just a few minutes, most people are responding, so that's great. All right. No one from shelter or housing so far, a little bit from peer, some outpatient healthcare, and some other. Thank you for doing the chat. If you are in that other category, Zoom only lets us put so many answer options, so it's limited. So thank you for that. Okay. Give just a couple more seconds for folks to type in an answer, and then we'll end and share the results. All right. Okay, I'm going to go ahead and close the poll and share the results. And so mostly from behavioral health clinic or treatment programs, also really close with educational setting. You just need to close the result box in your screen, and that's how you get rid of that. I've been stuck with that. Like, how do I get rid of that square? Okay, so at this point, are we doing another poll? I think we're just doing the work setting. Or are we doing the role?
That's the only
poll
okay. To survey the audience about their professional role at this moment.
Great. Thank you, Gabriel. Okay, well, at this point, I will turn it over to our esteemed presenters and let them take it away. Thanks so much for joining us.
Thank you so much. I'm just going to get our slides here. Okay, well, I'm Jennifer Piel, and I am delighted to be joined by Dr. Sarah Walker this morning as we discuss this important topic of policy making in behavioral health. This is an introductory webinar, and we'll cover some topics related to the process of relaying research or scientific knowledge in the policy process, interests of important stakeholders, and also discuss at least one example of a successful model of policy impact. So as mentioned, this is a webinar series that focuses on issues at the intersection of behavioral health and the law. For those who were able to join last week, I spoke about forensic mental health and training. The focus of this week is your role in advancing evidence-informed behavioral health policy making. And next week, there will also be another presentation on the intersection of behavioral health and the law that will focus on psychotherapies for persons with serious mental illness in high security settings. So let's turn to the topic of today. As you are aware, healthcare providers and health researchers have opportunities to play important roles in health advocacy, but it can be really challenging to find avenues for formal training or skills to pursue these activities on a community or systems level. It's helpful, I think, to start with this. What is advocacy? Well, it's a wide range of activities conducted to influence decision makers at various levels. Advocacy can take many different forms. Included here are some examples of what advocacy can look like. 1, legislative changes through policymaking. And this is really the focus of today's presentation. Now, some people will focus on multiple means of advocacy, and others will really focus on just one means. Another type is elections through political campaigns. Another form is the courts through litigation. And this is another way that I regularly engage in advocacy, through expert witness testimony, consulting on legal cases, and working on amicus briefs for appellate level legal cases. And then another form is social movements through education. This is what we plan to cover for the remainder of the hour today. First, we'll talk about general concepts of policymaking and research advocacy, and Dr. Walker will lead us through that. Then we'll talk about communicating with key policy players, and both of us will discuss various policy players. And then Dr. Walker will provide a successful example from her work. I think we have a quick poll, and then I'll turn it over to Dr. Walker.
I can help narrate that. What's your experience with health policy making? And that just helps the presenters kind of know where everyone's at. So have you joined an advocacy organization, called or written to an elected official, personally met with an official, written a policy brief, or other? Definitely many folks have called or written to an official or joined an organization. %, have written a policy brief so far. That's pretty great. Just give a couple more seconds and then we'll share the results. Okay, well, I'll go ahead and end polling there and I'll share the results. So yeah, over half have called or written to an elected official, 35% joined an advocacy organization, 21% met with an elected official, 9% written a policy brief, and 28% of others, a lot of other things around policymaking. So thanks so much. That's great advocacy on everybody's part.
Great. So we'll let Dr. Walker now.
Oh. Great.
Sorry,
right, well,
for some reason, there we go.
Okay, fantastic. All right, well, hello, everybody. So I'm going to be, there's a lot of things that folks maybe want to advocate for. I'm going to particularly talk about the use of research evidence in policymaking, something that we refer to as evidence-informed policy. And I think it's really important that we use the term evidence-informed rather than maybe evidence-based or empirically supported, because as we're going to talk about, policymaking is so complex and needs to be informed by so many different voices and perspectives that responsible use of research evidence is the integration of that particular type of information along with a lot of other information from other stakeholders, community voice, other frameworks. So we'll be walking through a little bit of that. But at the same time, when there is good research evidence available on the issue that's being addressed, we would like it to inform policymaking. And I just, without going into great detail, just review briefly where this area of scholarship is. In around the 1970s, a researcher at Harvard, Dr. Carol Weiss, became interested in how policymakers use research, largely because she had been involved in doing very large national research studies of social programs like DARE, other kinds of educational programs. And like a lot of us who have done these kinds of research studies, found that policymakers didn't really reference it or use it as they were developing policy. These programs continued to be funded, or programs that seemed to be effective didn't seem to be funded at a higher level, for example. And so she became interested in how policymakers do use research evidence, and did a lot of observational key informant interviews and other observational research, and proposed, along with her colleagues, sort of a typology, and concluded that policymakers use research in really one of three primary ways: conceptual, symbolic, or instrumental. And conceptual describes the use of research to gain a new perspective on an issue. So it's not that it's really like a single research study directly informs like a decision around policy, but it's that a body of research or a certain way of doing research sheds new light on a problem or an issue. The policymaker and other stakeholders may begin to see that issue in a different way. Symbolic is really the use of research to support a position that's sort of already been decided. And we see it a lot actually in advocacy. So it's already kind of been determined which direction an advocate or policymaker wants to head, and then folks will sort of gather their research to support that position. And instrumental use is closer to kind of the one-to-one, where research is used to, directly create a policy product. So it's referenced as the reason for going in a certain direction with like a bill or a law or a contract. The scholarly area of like policymaking interventions, evidence-informed policymaking interventions, is actually pretty young and new. There haven't been a lot of like randomized controlled trials, for example, of how to influence more evidence-informed policymaking. But what we do know from a combination of some controlled studies and a lot of observational studies is that the use of research evidence in policy is facilitated by trusting partnerships and relationships. This is it's a very relational area. And when there isn't a prior relationship between like what we call a research intermediary, which would be an organization that sort of tries to be the voice of research and policymaking, when there isn't a personal relationship, tailoring information to a policymaker's area of interest, whether that's regional or trying to send information about something the policymaker is interested in, that is also shown to increase the use of research evidence in policymaking. Next slide. So what we're really interested when we're talking about evidence-informed policymaking, we're really talking about what is better social policy. And there's two policy types that we think of: big P and little p policies. Big P policies are laws, regulations, things that govern, behaviors, institutional behaviors, community, across, a large region, and is usually enacted by state legislators or county councils or city councils. And then little p policies are policies that are instituted at an organizational level. So they're often, the institution voluntarily adopts them, but they govern things like hiring practices or appropriate, workplace behaviors, or just an initiative. For example, in public health, health in all policies is something that individual organizations like schools and businesses, that they may adopt a framework. We're seeing this a lot now in really exciting ways where many organizations and institutions are adopting anti-racist frameworks. So they're voluntarily adopted, but then they end up influencing sort of how that organization is run. Let's go to the next slide. So just to get back to this, what I opened with to make the point about where we want research to live in sort of this complexity of everything that should be informing good social policy. And I show this slide just to emphasize, for those who are interested in specifically translating research evidence into policy, something that's a quick learning curve for a researcher, a research intermediary, is that policymakers often looking for a pretty clear answer direction from a researcher about which way to go in a policy question. And a lot of time researchers aren't developing their research to be that directive about exactly what you should do, and often like to, put appropriate caveats around their research and what it shouldn't be overextended. And in some ways that's really appropriate and good. We don't want to overextend research or claim more truth, than it should have. At the same time, it's really useful for researchers and research intermediaries to try to give as concrete advice as possible about what are better directions to go based on the weight of the evidence in that research area. And we'll go to the next slide. So this slide is going to look a little, boring and maybe academic, but I think that it's a really useful framework for understanding how to grab the right moment in policymaking. So there are, there's of course a number of different frameworks that try to describe the process of how does an issue, any single issue amongst all the issues that anybody could possibly care about, how does a single issue sort of rise to the top in terms of attention and focus and advocacy? And I like the simplicity of this framework. It's called multiple streams. And it basically proposes that three things need to happen to open what is called a policy window. And once the policy window is open, then there's an opportunity to make a shift in that area for policy change. So what are those three streams? There's the problem stream. So an issue needs to be raised to the consciousness of policymaker and the coalition of folks around policymaking that there's this particular problem that it rises above all of the other problems and needs to be addressed. And then the policy stream describes that there's this viable solution to this problem. So I'm gonna give an example here in a minute. And then the politics stream is that there's general political will to address this problem. So for example, let's take, for the sake of argument, I saw a lot of folks are working in behavioral health agencies. So something in our region, in our state, I should say, and I assume our region, that is of high concern to everybody is the low reimbursement rate for Medicaid for mental health services. So this can rise to the attention of policymakers because it's contributing to high workforce turnover and dissatisfaction, and it's really impacting the ability of community mental health agencies to stay afloat because they're not, Medicaid is not paying enough for mental health services. So the policy stream means that there's a solution to that. And it's really quite complex. If anybody's worked to try to work at the policy level around Medicaid reimbursement, it involves actuaries, it involves federal restrictions. So it's really clear it's a problem. And then once you get into, what's the solution? if there isn't, if someone hasn't thought about this for a while and kind of done the legwork needed to figure out, okay, this needs to move and then this needs to move, the policymaker may feel like, well, I agree it's a problem, but nobody's handing me a solution. And then that would mean that the policy window can't close. Or maybe there's a solution, and then on the politics side, there's some disagreement with various stakeholders about how high that rate should go, or there might be pushback, or there's other people saying, well, we can't sustain that, or that takes away from this other contractual requirement we have, et cetera. And then that would also keep the policy window from opening. But if all those things lined up, there's a viable solution, there's political will, then that policy window opens up. And another key thing in this particular framework is the value of a policy entrepreneur. So a policy entrepreneur, a policy champion, is likely not going to be the policymaker themselves if we're talking about a legislator in this particular case. It could be, but it's often somebody that's been working in that area for a while that's also close to policymaking. And at the end of the session, I'll provide an example of how, in collaboration with a nonprofit, our shop act as a policy entrepreneur around some legislation that passed a few years ago. And then that person or group of people do a lot of the legwork to line up all the stakeholders, kind of making sure there aren't going to be any big surprises once a bill actually gets heard in committee or on the floor, and sort of all the important people are lined up. And then once all that happens, you increase the likelihood of change. All right, so let's go to the next slide. Great. So now we're going to talk about some particular policy stakeholders and sort of what role people play. And we're going to be talking about system administrators and leaders, advocates and nonprofits, legislators, and media. I'm going to cover system administrators and leaders, and then Dr. Piel will jump back in to describe some of the other stakeholders. Great. So system administrators and leaders are, folks in our government who are really in the other two branches primarily. So legislators are, passing the laws, and we're trying to figure out what change in law, what new law, what adjustment to law needs to happen. System administrators and leaders are often carrying out those in specific contracts, specific codes. And of course, they're setting their own policy in different ways. So, they're getting money from taxes or from federal money that have to be spent, and setting their own policies around how that money is going to be spent. So in relation to kind of what we're talking about today, really important system leaders include our, like your healthcare authority, secretary and directors, your managers, your supervisors and program leads. All those folks have decision-making capacity that can really influence the kinds of programs that get funded, the kinds of, for example, treatments that the Technical Assistance Center may be putting out through its webinars, through maybe advice from some of these state leaders. On the judicial side, the judges and the court administrators make a lot of decisions that impact who's going to be coming into court, who may receive a diversion, what kinds of sentences and dispositions people may get, for example. So, in our shop, we collaborate a lot with healthcare and court system leaders, county public health departments, because there's a lot of influence in actually directing how programs look, even after laws are passed at the state level. The real work happens sort of in those contractual and what we would call little p policies. Okay, well, I will hand it back to Jennifer.
Great, thank you. So let's look next at advocates and nonprofits. These groups cover a wide variety of constituencies that are similarly focused on influencing policy and practice. These groups in particular can be good allies because they are typically funded outside of government contracts and are often more willing to challenge existing policy. So examples here include consumer groups, public interest groups, and state and national medical or other health societies. These groups can be useful to know because they commonly have an established identity and may have already established relationships with key actors. Their membership may have technical expertise that align or complement your expertise or goals. And these groups can affect policy in several ways, particularly for large associations. For example, the American Medical Association. Members pass internal resolutions that mandate advocacy efforts on the topic and are often associated with a dollar amount to be spent on lobbying efforts. Some organizations have internal legal staff or fund attorneys to participate in legal cases on topics of interest to the organization. This is typically through the form of amicus briefs. And some organizations will hire lobbyists to support direct and indirect legislative advocacy efforts. So if you're starting out, here are some tips with advocates and nonprofits. Find out who the advocacy players are in your topic area. And you can do this by looking at who signed in support or even opposition to legislative bills of interest. You can attend town hall meetings related to your topic of interest and talk to your institution's government relations individual or lobbyist if you have one. Approach them so that you can discuss your research or your other technical skills and how you can partner. Another key policy player is the legislators. So legislators are responsible for thinking about big picture ideas and representing the public interests. They typically become mini experts in a topic area while having to absorb information about a vast array of issues. It's easy to think about the easy wins that they'd like. For example, passing legislation that requires no budget or sponsoring a prime bill. Now, legislators vary in how much they want to reflect different constituencies, such as the community, advocacy, or research. They should be very accessible to you because part of their job is to meet with you as constituents. It's not always as easy as you think, though. So it's useful to know that the staffers can be highly influential and sometimes they are more available. I've listed some prompts that are useful to think about in advance of contacting a legislator. These can help you clarify and tailor your message. So for example, what are your technical or research interests? What is it that you want to happen to advance your cause? What experiences did the legislator have already with a topic? Why should they care? And how can you advance your objectives together? So what are next steps you can take if you want to work with a legislator? Well, get to know which legislatures in your state are interested in your topic and what kind of bills they have already sponsored. It's great to do some homework in advance. Perhaps talk to their staffer first or other researchers who have worked with them to get a better sense of the experience level the legislator has with a particular topic. And then set up a time to talk, to introduce yourself, explain your research interests, and explore their needs in that area. And then finally, have some patience. A repeated theme in this talk is that you want to establish relationships over the long term. And then here is another key policy player. It's essentially an indirect advocacy through media and other sources. Television, print media, online resources, radio, and others are conduits to present current and timely information. Public opinion about topics, as well as those of policy leaders, may be influenced through media efforts. And you can use the media to raise awareness of an issue or provide education about a topic. And it can generate public interest, not only in the public itself, but also such that it raises the interest for policymakers. How can you get involved in using indirect means? Well, consider creative ways to include media in raising awareness and providing education about your program or topic. So we've listed here some prompts that are helpful to think about. For awareness, think about topics that you want to cover and why you want to promote this topic. For education, identify media sources that can relay your message and do so accurately. Are there known reporters, for example, that tend to cover a related topic? Think about writing an op-ed. And then influence opinion. Think about whether your goal is to have a long-standing media campaign, or perhaps at this point you're wanting to share one particular story or raise interest in a very narrow topic. With that, let's talk about ways to bridge the communication gaps. So gaps often exist when researchers or healthcare experts try to communicate effectively with policymakers. For example, scientists and others commonly use jargon that may be difficult to understand for some policymakers. I think it's helpful to think about ways in which health providers and policymakers may approach things differently. In this way, you can recognize and consider making some adaptations to assist the policymaker in making use of your information. So first, goals. Know your goals and be clear about them. Recognize that the policymaker may focus on what is reasonably possible in contrast to your full ask. Information type. So researchers and health professionals often focus their efforts on what we do not yet know and like to propose questions for future or additional study. But it's really helpful to recognize that policymakers often focus on what we already know. They prefer clear and succinct answers to issues. The level of detail. So researchers and other health professionals may focus narrowly on details that may not be appreciated by policymakers. Policymakers often benefit and desire a broad understanding, a high-level understanding of the topic. The form of communication. Health professionals and researchers are used to describing their subject in depth, often with a scholarly review and detailed discussion or methodologies. But policymakers may prefer short, easy to understand, written and oral materials that distill just the essential points into concise language. This way, they may be able to use that language in their own presentations or rephrase it to their own audiences. Timing. Policymakers frequently have to be reactive and respond in short time periods to meet legislative deadlines or constituent demands. It can be challenging for researchers and health experts to participate under short notice or short timeframes. So think about this, especially if your work can take years of research to get to the point of actually disseminating findings. And then finally, establish credibility and these long-standing relationships. As we've already mentioned, building relationships and establishing credibility over the long term can be vital. By presenting consistent and high-quality work, you will establish legitimacy and become a respected participant in policymaking. And then let's talk about coalition building. So it's not uncommon for several stakeholders to share an interest in policy development on a topic. Taking advantage of this to build coalitions and promote multi-advocacy strategies can be very useful to get out information to policymakers in a timely manner. Essentially, this is the concept of strength in numbers. Sometimes formal alliances are made where entities agree to share resources or costs. Other times, there are informal collaborations. Collaborations can be short-term around a specific project, or they can be long-term. In getting started with this, find out who else is working in your space or has interests that align with yours. By identifying potential collaborators, you may be poised to pool or draw on already established resources. These could include time, energy, expertise, even financial resources if needed. In some cases, collaborations may broaden the context of your work. So think about ways in which the collaborative efforts could complement one another. I will caution, however, that there could be potential risks, such as divergent interests on select topics. So also think about the reputation of the other stakeholders, and even if mutual interest exists, will the association be helpful to your cause or harmful? It's worth noting that a strong coalition can really broaden the base. This can promote stronger advocacy. Okay, with that as background, I'll let Dr. Walker provide an example.
Great, thanks. We go to the next slide. Thought we would provide just one example of a policymaking process that engaged a lot of the partners and the roles and the processes we've been talking about. And then we're also going to give some concrete direction for where to go to do things like look up a bill, sign in and support, sort of individual things people can do as well. So we're going to talk a little bit about a mental health diversion bill that our group was involved with a few years ago. And it was, looking at the issue, was externally funded by a foundation that was interested in doing policy level work in juvenile justice system reform. And the problem that had been identified is that there was low use of a legal option in Washington state that would allow courts to avoid the use of long-term secure placement for youth who had mental health needs. It was called the MATA, the Mental Health Diversion Alternative, and it was very infrequently used. And there was a sense that we wanted to avoid the use. Most people, agree we want to avoid the use of secure placement if there are community programs that are less restrictive. So along with a nonprofit, the Center for Children and Youth Justice, our team at the University of Washington started by doing just some needs assessing and trying to figure out why there was such low use of this option. As part of the planning for this, we engaged essentially a design team that included legislators from the House and the Senate side. And the reason for both will become clear too as we talk about sort of how a bill becomes a law, which we'll just cover super quickly as we're getting close to time here. And as well as a court administrator and a mental health administrator, and then our team. So in the process of doing needs assessing around this, we discovered one of the reasons there was such low use is because in order to access this placement alternative, there needed to be an extensive mental health assessment prior to disposition or when a youth would receive a sentence from the judge. And there was a lot of concern about doing this from defense attorneys who then that information would be part of the record and were worried that it would be used to actually extend a youth sentence because there would all this information about their mental health needs might bias the sentencing. And so defense attorneys often did not want the youth to access this alternative because the potential for biased information and disposition. And so we talked about the policy windows, right? It was clear there was a lot, everybody was kind of on board with this as a problem. But in terms of a solution, it became clear that in order to address the issue of information coming before a judge would probably have to pursue a court order first so that information couldn't be used as part of the public record. And that started to feel like not a very quick solution or not a very tractable solution. And so rather than going that way, the group pivoted to more of an upstream solution and looked at the ability of prosecutors to divert cases prior to any formal hearing or review. And if prosecutors were able to have more discretion in diversion and then creating agreements for kids to go to community services prior to filing, that would be another way to have kids access community services. So that seemed acceptable to everybody. And in the criminal justice realm, in terms of bills, it's really important to have prosecutors on board as well as law enforcement. And so we acted as that policy entrepreneur and sort of checked with different stakeholder groups about kind of what they'd agree to or not. And everybody seemed very okay and happy with expanding the number of diversions that could be eligible to a youth. So the policy solution ended up being that in the state there had been a legal restriction to one diversion per case, and that was expanded to 3, along with allowing mental health facilities to act as approved referral placements straight from law enforcement. So law enforcement could take youth directly to approved mental health facilities rather than to juvenile detention centers, for example. So the end result was a bill that was able to garner enough support to pass. What's interesting is that just a few years later, after setting the stage with kind of the appetite for moving towards more diversion in juvenile justice, a different set of legislators and kind of stakeholders actually now made diversions completely non-restricted. So it's up to the court and prosecutors how many times they want to divert. And I think it's a good illustration of how the policymaking process often proceeds kind of in these steps, and people get kind of more used to sort of see things in a different way, or adopt a different perspective around an issue, and suddenly a lot more things seem possible. So if we go to the next slide, just really quickly, why it's really valuable to be finding legislative champions for what you're interested in on both sides, or both sides of the House, right? So a bill, in order for a bill to become a law, to kind of go back to our I guess high school days or middle school days when we all learned this, a bill has to be passed by both sides of the House. It's first introduced in committee, and then if it's heard in committee, you give testimony in committee, and then if it's voted out of committee, it'll go to the floor where everybody votes on it. And then if it is approved in the floor, it'll go to the other side of the House. A lot of times, obviously, senators and House representatives are collaborating very closely on common issues, and if they really want a bill to pass, they'll introduce they'll introduce different versions of the same bill kind of at the same time, and that means that they're working out sort of what's going to be the opposition, or what are going to be the amendments that will be acceptable on both sides, and then once those are passed out, they'll kind of come up with a final version that'll get voted on the floor of both sides of the House, and then that goes to the governor, and the governor signs, and it becomes a law. We go to the next slide. So I'm just repeating a couple of the important points that Jennifer made as well. Because policymaking is so relational, and there are likely a lot of players in this space already, the best way in is to figure out who the policy intermediaries are that policymakers are often looking to either get specific proposals. So in some areas like healthcare, it's likely that there's already very organized sort of coalitions that are determining what the problems are, determining what the solutions are, and then they're rolling those up to legislators to put in bill form. And so, becoming involved or knowing more about those processes. In Washington State, for example, anything related to kids and adolescent social development is being monitored at a policy level very closely by a group called Partners for Our Children at the UW School of Social Work. They do a fabulous job putting up updates on kind of where bills are at and what have passed or not. Or you can get involved with a group that's specifically focused on advocacy. A great one to look more into is NAMI, National Alliance of Mental Illness. They'll have lobby days, and you can go and talk to legislators with a big group, and those can be really fun to do and a really, really important part of the advocacy process. Next slide. Again, just going to the state legislator page. Sorry, this is also Washington focused, but hopefully it translates well for folks who are coming from different states. If you go to the next slide, just want to make a kind of a quick note. So on your own state's legislative page, you're likely to have something that looks similar to this. This is Washington State's. If you aren't sure, if you haven't, you can't find from an advocacy organization which bills, you should be following, you can just go to a bill lookup and type in the keywords. And that was on the previous slide. But if you know the bill, you can type in the bill. It'll tell you at what process it is in sort of its hearing and approval. And you can get email notifications that will tell you when it's going to be heard in committee. And that can be really useful because if you, It'll also give you instructions for how to sign in support of a bill, which you can do remotely, or you could go down and do it in person. You can also sign up to testify. And it's a great way to just show support for a bill that you think is really important and get involved in the policymaking process. Next slide. Great. Okay, so we've got amazingly pretty much on time, and we have about 9 minutes for any questions.
Great. Thank you so much for all that information. We do have a question from Michelle. So her question involves, I know it varies by state, but where would one typically look to find out which legislators signed in support of or opposition of particular legislation? So I think that is the heart of her question. So I don't know if you can try to answer that.
Well, when you look up the bill, it will tell you who prime sponsored it and usually there's a prime sponsor, and then there'll be a lot of other co-sponsors to a bill. So if you're looking for the purposes of finding who the kind of legislative content area people are, that's a great way to do that. Just look at who's sort of the first name on a bill. That's the prime sponsor. And that typically means they've taken that area on, whether it's healthcare or criminal justice reform. They are always going to be passing or, at least proposing bills in that area. As far as the yays and nays, those can be found in bill digests on the same page, and you can look up who all voted in support or not. In terms of other groups like advocacy organizations, I actually don't know offhand, Jennifer, if you are actually following the hearing in real time, you'll be able to see in that hearing who is signed into support or not.
Yeah, I definitely agree with Dr. Walker. Also, if there is a particular bill of interest to you and you are able to identify the prime sponsors, once you have that name, you could look up that person directly to see if they have been affiliated with other related content. And that can really help you identify if that's a niche area, a specialty of that particular legislator.
It's a double win if that legislator represents your district, because when it comes down to it, legislators are mostly accountable to the people in their district, and that's very, very powerful. And regardless of content interest area, simply writing to the people in your district about the thing you care about can be very, very powerful. It really is. It's they really do pay attention to that. I mean, at the end of the day, that's who's going to reelect them.
I just saw that there was a great question about what is a bill digest. Excellent question. And if this is an area that's new to you, the bill digest is an excellent summary, if you will, of what has happened with the bill to date. You can find it typically on the same website as you look to find the bill itself and to find who has sponsored it. And it usually is just called that, a digest, and it will summarize kind of the background. What was the precipitant to the bill? Do we know that? It will give a history if this is something that's been before the legislature before, and any summary of kind of testimony or key points around the bill. Oftentimes they'll have some summaries around support and also a discussion of the opposition. So it's just a very nice, concise way to get organized around the bill and really let yourself kind of understand the key points around it.
Great. We have another question, which is maybe a good test for everybody on the in the audience. What is the main takeaway from this presentation? Because there's so much involved, so many good messaging points about know your audience and what are your messages and how do you make sure you're aligning at least with what might be important with folks, but still getting your message through. So I don't know if you would have a kind of a summary. People can also throw those in the chat if they like, but yeah, what would you say would be your main takeaway that you'd want people to get from today's presentation?
From my perspective, it's really, building those relationships. very unlikely that you're going to have a one-time encounter that's going to lead to significant policy change. But if you can establish a relationship with a legislator or even health organizations that regularly work with your policymakers, allow them to understand your perspectives, build up that relationship, demonstrate your credibility, it's going to just extend, for future encounters. Once they know more about what you do and that your research is sound and that you're really a strong advocate in this area, it's likely that they may even come to you for future work and wanting to learn more about a topic if it's related. So for me, getting to know people and then slowly building up those relationships is key.
Yeah, I would agree. And I do think there's a lot of information. And I think the reason for that is folks are in different positions in regards to what they can do in terms of policymaking. So thinking about, where do I fit in this ecology? What do I have to offer? What information do I have? Am I in a good place to try to, influence media? Am I in a good place to partner with an intermediary? Am I already an advocacy organization and want to strengthen my relationships with policymakers? So just reflecting on where do I fit in this and how can I influence policy for the good?
Yeah, and I know back when I was in grad school, social workers were wanting to advocate and just didn't know how to do it. And so it's such a fear-inducing experience if you've never talked to a legislator. And so they do these practices and lobby days and all those kinds of experiences where there are a lot of people that have put in the time and the effort to really try to teach others how to do this effectively. And so I think if you don't have places to turn, think of what affiliations you might have, what are groups in your area, because I think people are here to help. Here's a couple more questions. What suggestions do you have for working with private organizations, for example, insurance companies that often have a take it or leave it mentality with their policies?
Well, that's interesting. We work a lot with payers, and I think that I'm in a different position, obviously, because we aren't writing contracts with payers, but I do feel like they really do want to hear about what's going to be effective. As we talked about with the policy window, most people can agree there's a problem. The question is, what's the solution? So I would say if you feel like you have a solution that lines up what contingencies the payers are under, which is they've got to keep their contracts and they have to stay financially solvent. But you have a solution that can help with that while getting what you need. People are going to be open to that. So I would say think about proposing solutions.
And just another comment before we wrap up. Professional associations often have lobbyists who have the relationships with legislators. Association may have an action committee for a member to join relative to political action and advocacy. So yeah, thank you for that reminder, because those are other resources for people to learn. All right. Well, I am sorry that we could go on for many more hours. I think this is a great introduction, as you said. So we've gone through our questions and discussions. Just a reminder, the survey link is in the chat. So you'll see that there, and it really helps us tell the presenters today, how did this go? How did it land? Plan for future sessions. If there's something you wish you heard, if there's something that really resonated with you, that's really, really helpful for us and them to hear. It is all confidential and aggregated, so please don't worry about any of that. But we love to read your comments and ratings. If you want to know more about us and register for additional resources and training opportunities, please come to our website at www.mhttcnetwork.org/Northwest. You can sign up to receive our newsletter. We do announcements when events like this are planned, or we also are on some social media channels. Please note, as they mentioned a couple of times, our next week event is one of our core faculty in our center as well, Dr. Sarah Kapelovich. So it will be very, very insightful and helpful again. And look forward to see you. And thank you again to our presenters for a fantastic presentation. And thank you for everyone for taking the time today for learning more about this important topic. And we hope to see you again soon.